Many of us enjoy a drink or two at happy hour, but for some people, drinking is a serious addiction. How can you recognize the warning signs of alcoholism and what's currently available to help treat those people who are suffering from it? To shed some light on these big questions, we're joined by our guest, Dr. Aditi Trincaday, clinical instructor for psychiatry at New York University. Thanks for joining us, Doctor.
Thank you.
Now, how big of a problem is this in the United States? Alcohol addiction, alcohol dependence. How many people are we talking about?
Well, we're talking about up to 20% of the U.S. population at times has had problems with alcohol. We define alcohol abuse and alcohol dependence as two separate issues. But when people are talking about alcoholism, they're usually referring to alcohol dependence. And this problem cuts across many socioeconomic lines, so this really can affect people in all age groups, in different professions. It's important to remember that.
So how could people know if they were, quote-unquote, teetering on the brink of having an alcohol problem? What are some warning signs?
Well, when we evaluate people for an alcohol problem, we're looking really at the impact that alcohol has on their life. So we're looking at how it impacts their functioning at work, how it's affecting their relationships with their family and their friends, how they're able to fulfill their obligations. We're also going to look at how alcohol affects them physically, and some of the things we look for are tolerance, which is needing more alcohol to get the same effect, or withdrawal, which is having physical symptoms when somebody stops drinking. So those are all factors we take into consideration when we look at whether somebody has an alcohol problem or not. It's a good time for me to point out also that when we're talking about healthy amounts of drinking, there are certain guidelines that we recommend, and that's for men no more than 2 drinks a day, and for women no more than 1 drink a day. And above those levels, drinking can become hazardous to the health, and of course some people are not able to drink anything at all, so it's really an individual decision.
It certainly is, Doctor. It's good that you point that out because we've done so many studies on the heart health of wine, have a drink or 2 a day, but those are really, for moderate drinking, you're talking about maybe 2 drinks for men and 1 for women. That's a pretty moderate amount, right?
Exactly. And when we're talking about drinks, it's also important for people to realize that a drink means 1 12-ounce beer, 1 5-ounce glass of wine, or a drink that contains 1.5 ounces of hard liquor. So if somebody's having, for example, a Long Island iced tea, that might include 3 shots of liquor, then they've already gone over the limit just with that 1 drink.
You certainly have. That's a good point there, Doctor. Okay, what about all of these celebrities going in and out of rehab and recovery, some of them for alcohol problems? Does that hurt or help people who are more just commonly affected by this?
Well, I think that anything that brings the subject out into the open is something that's good for treatment. There's been a stigma around alcoholism and treatment for many, many years, and people feel often that it's been a moral flaw or weakness, and I think that anything that gets people talking about this illness is a good thing.
Is the 12-step program still the gold standard, or are there also some medications that can help people on their way to recovery?
Well, 12-step treatment is very helpful to many people, the self-help Alcoholics Anonymous model. However, there are an increasing number of medications that are used as part of treatment for alcoholism. I want to point out that they also should always be used in the context of other treatments such as psychotherapy, such as group therapy. Often family therapy can be very important as part of a comprehensive rehabilitation program. But that said, there are 3 medications that are commonly used for alcoholism. The first is called disulfiram or Antabuse. That's the oldest medication, and that's a medication that makes it difficult for the body to process alcohol.
It makes it more unpleasant to drink, right?
Exactly. So somebody who's taking this medication might get very ill, feel flushed, feel nauseous, and vomit if they do drink, and that can be very helpful for people to know, especially if they're in high-risk, tempting situations like weddings or other family gatherings.
That's a good point.
The other 2 medications, one is called naltrexone, and one is called acamprosate. And those are both medications designed to decrease the craving that somebody experiences for alcohol. They affect the chemicals in the brain that are involved in craving alcohol. So the idea behind that is that somebody craves alcohol less, and they ultimately may drink less or not drink at all.
Thank you so much for all that important information, Doctor. Thanks for joining us to talk about alcoholism.
Thank you very much.